Gum disease and periodontal disease is a process of inflammation of the gum tissue related to the bone. So oftentimes they say it's a silent disease because you don't feel a lot of pain or discomfort. About 66% of us over the age of 25 have periodontal disease. So it's a very prevalent issue, and it's something that we want to prevent, and that's part of the reason why we have patients come in to have regular dental cleanings and checkups to make sure that that's not something that's going to happen for our patients. As science learns more, and as research has shown us, gum disease or periodontal disease is not limited to the oral cavity. That's a very systemic problem that can cause various issues, especially heart disease, buildup of plaque in your arteries. All that kind of stuff can be caused basically by gum disease. So it's important to look at that as not just in your mouth, but a systemic condition that needs to be stabilized. Symptoms of gum disease can be bleeding gums, especially when you brush or floss your teeth. Oftentimes your gums might feel puffy, or there feels some sort of like strange itchiness underneath your gums, and that can be periodontal disease that's undiagnosed. And so that's the type of thing that we want to look at and be able to diagnose for you so that we can make sure that you keep a stable set of teeth for your lifetime. Periodontal disease is something that cannot be stopped, but it can be managed. And so by going to regular cleanings and being evaluated by our office every 6 months, we can help to maintain your dental condition and stop the disease as much as we can, but it can never be fully stopped, only maintained. When you come into our office for a periodontal evaluation, what we're going to do is make sure you get a thorough cleaning. And sometimes that thorough cleaning requires a little bit more advanced work. And sometimes we even use sedation for those cases to make sure that we can clean up your mouth as much as is necessary. As a prosthodontist, I'm not only concerned with the look of the teeth and the function of the teeth, but I have to make sure that the supporting structures are going to be stable. And by doing a thorough periodontal evaluation and treatment, that allows us to make sure that whatever I'm going to put into your mouth is going to be stable for the long term. If you have periodontal disease or gum disease, you can't wait to treat it, because the effects later on are going to be extreme in your mouth. And we're talking about losing teeth, having issues with moving teeth, and overall problems in your systemic health. So those are the types of things we want to avoid. And so waiting around and thinking that things are going to get better on their own is never going to happen. And periodontal disease is one of those things that you have to take care of, just like any of the other medical needs that we have.